Hello everyone, this is Catch Life, and today we are here with our Professor Dr. Hüseyin Karayılmaz. So first of all, how are you?
Thank you, Tunan. And hello everybody from Antalya, which is the most famous and the most popular touristic area of Turkey. And I advise for everyone this season, September, October and November is the best season of the Antalya
For traveling.
For traveling, if you like to swim or other things, if you want to plan holiday, this is the most suitable season. The weather is not so hot, and the sea water is very nice, and I advise you not miss this season.
Of course, we always say to patients just to visit us specifically on fall, because this season is better in terms of the prices too, for the flights and hotel, etc. And it's also comfortable to spend your time for recovery here too, because it's not that hot, as he says, and do a little bit of holiday-ish type of visitation is making it great, because Antalya is a very touristic place. And okay, so let's get back to the topic so that we can just inform the patients today for mostly asked procedures that we have in terms of the dental treatments, which are all on 4, all on 5, and all on 6. These are implant techniques that we're going to speak today, and then he will be guiding us, and he will be answering all of our questions. And you can also just DM us all of your questions, and we can answer it whenever we are available again. Okay, we can start with it.
Thank you, Tunan. All-on-4 procedure is a treatment concept who cannot use prosthesis due to heavy loss of jawbone. This treatment concept allows fixing the prosthesis with 4 or 5 or 6 implants in total place at certain angles in patients with no teeth, with toothless mouth, with edentulous mouth. And also this treatment offers extremely successful clinical outcomes for edentulous patients who can start using fixed provisional restorations. It consists of the rehabilitation of either edentulous maxilla and mandible with fixed prosthesis by placing 4 or 5 or 6 implants in the anterior maxilla or in the anterior mandible, where bone density is higher from the molar region.
I understand.
If you placed 4, 5 or 6 implants in the mouth, we can make a fixed prosthesis with 10 or 12 or 14 teeth
in total
into the patient. And the other advantages with this technique is we can put the temporary prosthesis, we can place the temporary prosthesis just after the surgery. Nearly 1 day after the surgery, we can put to the mouth of the patient a temporary prosthesis, and he or she can eat some soft diets. Okay, this is the main advantages of this technique.
I understand. So what we are just focusing on here, the patients with has no tooth. And then actually this is life quality increasing procedure, because
they should use removable prosthesis. But if people who use removable prosthesis, when he or she is chewing, it's very difficult. When she is or he is talking in each other, it's very difficult. But when you are using the fixed prosthesis, there will be no problem. With edentulous, with toothless mouth, I will strongly advise you should do fixed prosthesis with all on 4, all on 5, or all on 6 concept.
Definitely. So Since we're just talking about all of these techniques for the implants, what are the advantages of the Olan 4, 5, and 6?
Yeah, the first advantages, the main advantages is this treatment concept has a high success rate. It's a very simple and very short procedure concept. It helps eliminate bone loss of maxilla and mandible. If there is no bone in the back side, in molar side region of the mouth, we will put the implants on anterior mandible and or anterior of the maxilla, where the bone height is very high, and we can do these implants very easily. So there is the opportunity to apply fixed dental prosthesis with single surgery to patients without teeth. Treatment and period of dental implant surgery is much shorter, as I say, much easier, because no advanced surgery like sinus elevation, sinus lifting, or to put bone grafts. We should not use these bone grafts or sinus elevation, sinus lifting. And so the surgery is more easy and more short.
I see.
Yeah. In the single time we can put all the implants. Also, it costs lower than classic dental implant treatment because we are using only 4 implant or 5 or 6 implant, and it's more the cost is very low. The another advantages for who use removable prosthesis. Removable prosthesis can cover the palate, upper jaw, and upper side. So when you are talking or when you are eating, it's more difficult. You can't take the taste of the meals or other diets.
It's uncomfortable.
Very uncomfortable. In this technique, we are using fixed prosthesis, and there will be no cover of the upper jaw. There will be no cover on the side of the jaw of the patients, and the prosthesis will not remove the mouth. And also the cleaning and the hygiene of the prosthesis can be set very easily. When you are eating the meals and the yiyecek
the foods
can go under the prosthesis, and you should, when you are eating, and maybe you should remove the prosthesis and to clean it. It's very difficult for the people. So in this technique, if you do the fixed prosthesis while you are by your brushing, also with tooth picks, also with the dental flosses, you can easily clean it. There will be no problem. And if you we can plan an Hollywood smile, smile design. We are doing to the people smile design. In removable prosthesis, it's very difficult to design this. But this is the fixed prosthesis. If you in the beginning we are planning the smile design, we are designing the smile, and when we finish the prosthesis, the smile design is will be appear on the patient. But in removable prosthesis, it's very difficult. It's very it's not aesthetic, I think. And another, how can we say? Also, with the patient who cannot use removable prosthesis or with nose effect reflexes, they cannot use removable prosthesis. But in this technique, it's a fixed prosthesis, and there will be no problem. And also from the patients from other countries, As number required treatment seasons is very low, it's appropriate for patients residing abroad.
I understand.
Okay.
So in total, there is going to be 2 visits for
Yeah.
this procedure. After
Yeah.
the implants, they need to come back again for
Yeah.
another visitation
Yeah.
for doing the smile design,
Yeah.
actually, like ending it. So underlining certain points are important here, I think, like people have the patients specifically who cannot use prosthesis or not suitable or have nausea reflex, which is
Yeah.
like they make themselves, feeling sick, cannot use the removable dentures.
Yeah.
It should be fixed with implants. So in this context, it also medically helping people's life quality too. So the other question is that to whom can all-on-4, 5, or 6 implants technique be applied in this context? So
Yeah, we are preferring this technique who cannot, if there is no enough bone in the molar side, and if you want to if you want to use fixed prosthesis, we are using this technique. If someone can make an implant, we can do this. We can use this technique. All-on-4, our 5 or 6 treatment can be applied to all patients without teeth or with teeth that will be extract or
this is the questions that I was asked for the next time, because we also have patients contacted us for asking for all-on-4, all-on-6 and 5, just because that they think that, or they are saying it, their teeth is in bad condition, like it already needs to be extracted. They have teeth, but they're not durable, healthy enough to keep it, and it causes problem for them. So how do we follow a way for this? Do we remove all the teeth that is unhealthy after the X-ray that you see, and then move on with all-on-4 or all-on-6, depending on the patient needs?
We can extract, and in the same season we can put the implants.
On the same session, you can do both of them.
Yeah, we can do both of them.
Extracting and then putting the implants.
It's if after the clinical and radiological evaluation, maybe a computer tomography after the measurement of the bone mass, enough bone, and we can do in the same season we can extract the tooth, unhealthy tooth, and we can do the implants in the mouth.
I understand. So what are the stages of all-on-4 treatments?
There is, as you say, there is 2 stages. I think 2 season. After the planning of all-on-4, all-on-5, or all-on-6, first we are checking the mouth with clinically and radiologically, as I say, with computer tomography. If you plan all-on-4 or all-on-5, patients comes here, and in the first season we will extract or put the implants in the mouth of the patient. In the 1 day later, we are making temporary bridges, temporary prosthesis to the mouth, and the patient can go back to his country, and 3 months later he or she will come back to our country, and we will do the final restoration, final prosthesis, and we will fix it to the mouth. It's all.
I understand. So we give 3 to 4 months for a healing recovery, because we want the implants to be integrated to the bone. Am I right? Okay.
Bone integration.
Another most asked question: will I have any pain after all-on-4 process?
There will be no pain. If after in the procedure we will do local anesthesia, and you feel nothing, and the implant procedure is very short procedure. maybe in 20 minutes it can be finished.
Like all on
Four.
For 8 implants.
8 implants in 30 minutes, 20 minutes we can finish. After the procedure, maybe a little pain, a little şişlik mass or swelling. But if you, the dentists will give you painkillers and antibiotics.
Of course.
Lower antibiotics, not so high.
Strong ones.
Not so strong. Simple antibiotics will enough for the control the pain and the swelling.
Yeah.
There will be no pain, no other problem.
It's great actually. So the people who are asking the patients, sometimes they're saying that they're very afraid of the surgery itself, and sometimes they say that what about the anesthesia, like, or sedation, local anesthesia? What type of anesthesia that we use for implants?
Regularly we are using local anesthesia. Local anesthesia, I think it's enough. But to the patients who are very from the dentist, very
like
afraid phobia, they're very afraid from the surgical procedures. We can do sedation, and we can do, if it is very simple procedure, all on 4 or all on 5. But if he wants, I want to remember nothing. We can do general anesthesia. He will or she will remember nothing.
As if it's just like a procedure in a hospital.
Hospital.
I see.
As also, I am the pediatric dentist. We are using the sedation or general anesthesia to the little children for their treatments. We will do 2 hours, 3 hours general anesthesia or sedation processes, but this is very short. It is approximately 30 minutes or 20 minutes.
So just to summarize, what I understand is that it's a very simple procedure that takes 20 minutes, and it can be done under local anesthesia, which they numb the area locally with injections. However, if the patient has phobia or any type of anxiety about the procedure, the surgery, or maybe the dental clinic itself, there are some patients who are afraid of it. They can go for general anesthesia, of course. The patient won't be remembering anything when the procedure is end. So this is a great option for the patients with fears and phobia regarding to the dental clinic too. And another great question is that how will I get my nutrition after the all on 4, all on 6, all on 5?
It will be more comfortable. How can I say this? Because patient, when he or she comes here, there will be no tooth. Or there will be in his or her mouth unhealthy teeth with no chewing. After this procedure, we will do a temporary prosthesis, and he or she can begin to chew or eat something, but soft diet. In which time, after the integration of the implants to the bone, jaw bone, for nearly 3 or 4 months, as you say. After the 3 or 4 months, with doing the final prosthesis, he can get nutrition as he or she wish. Everything. He can eat everything.
Everything goes back to normal after 3 months.
But in 3 months, soft diet, soft, and the dentist will give some recommendations to the patient.
This is great because we're just giving time for the implants to heal. And during that time, we shouldn't be pushing the area with hard foods and anything. It should be all soft. And he will be recommending the soft diet plan, or what you can eat and what you should avoid eating, so that you can just decide together after the procedure itself. Another question is that, is all-on-4 process a successful procedure? Since you're a professor dentist, we just wanted to ask, because you're experienced enough to see lots of cases, is it successful?
With scientific reports in literature. Today we are doing too much implant treatment, all-on-4, all-on-5, all-on-6 and others. Scientifically, it is very has a high success. It's a simple procedure with with toothless mouth. It's a very high success rate. I strongly recommend to the patients to do all-on-4, to prefer all-on-4 or to all-on-5 or all-on-6 treatments. It has a lot of success rate, high success rate.
Okay, so there is one more thing.
Yeah.
The last thing actually that I'm going to talk about, because I'm also curious of. The concept that I'm going to talk about is not being performed by every clinic that we see.
Yeah.
So this is something rare, but it sounds like more like you're guaranteeing the implant treatments by strengthening it with all-on bar concept.
Yeah.
So what is all-on bar concept?
All-on bar concept is a part of all-on-4, all-on-5, all-on-6 implant concept procedure. In this, when we are doing the prosthesis, we are putting a titanium bar over the implants under the prosthesis. Titanium is a very light material and very strong material and has some flexibility.
Good.
So if you put these titanium bars over the implants, we can cover implants and also we will cover prosthesis. And so patient use these prosthesis or implants very comfortable. This is the main, this is the biggest feature that distinguishes our dental clinic, Catch Life Academic Dental Clinic. We are using titanium bar technique.
For all-on-4,
all-on-4, all-on-6, all-on-5 or all-on-6 treatments. I advise to the patients who are planning to do this procedure with edentulous mouth, with toothless mouth, asks to the clinics, are you doing titanium bar? Yeah. It's very important. It is a we can make the success rate, as you ask me
the success of the treatment.
The success rate is go to the space. Yani there will be no broken, there will be no other problems. So it will be more easy to use it to the, with the patients.
So what I understand is that all-on bar is actually like function as a shield, as a protective barrier for the implants and also the prosthesis, which actually helps the patients to keep the results long-lasting and also durable. So this technology is the latest technology. After we are using the computer-aided designings, millings, CAD/CAM technology. This concept has evolved, including the all-on bar concept, which is adding to milled titanium bar structure to the over the dental implants under the prosthesis, which helps them working together to protect the implants or prosthesis from failure. Yeah, like a barrier, as I said. So it's just like a shield. Okay, so this is an important part that everyone should ask their dentist regarding to all-on-4, all-on-6, and all-on
bar concept.
All-on-4, whether they're doing it with a titanium bar, which is what we say all-on bar concept.
Can we do all-on? Patients can ask to the clinics. Can you do all-on-5, all-on-4, all-on-5, all-on-6 procedure? And also, are you using all-on bar concept? Yes, this is important. I will strongly advise you. Okay. So these are all the questions regarding to the procedure that we advise for toothless people or to the edentulous patients. These are all-on-4, all-on-5, and 6 again. If you have any further questions, please do not hesitate to ask us because we will also be you have a question. How can we decide? Definitely. This is one of the biggest questions, which I forget. How can we decide whether the patient needs all-on-4, 5 or 6? It's all about the patient. If you can, the minimum number is 4.
Yeah.
We should do minimum 4 implants. Or if you can do 5, or if you can do 6 implants. And we are asking to the patient to prosthesis with the number of tooth. It can be 10, 12, or to the, only for one jaw or upper jaw, 10, 12, or 14. If the patient wants to put me 14 tooth to my mouth, if he or she patient prefer this, we can do 6 implants.
Yeah.
Yeah, it is up to the patients and the dentist. They are talking each other and decides this. Minimum 4, maybe 5.
So
maybe 6.
This is patient specific first of all, because they will do the X-rays first and do the examinations. If the patient is suitable and if they go for the minimum, they can go for all on 4. But however, if the mouth is suitable for 6 or 5, and if the dentist strongly advising it, or the patient is accepting it, they go for 5 and 6 too. So thank you for answering all of the questions. Thank you for informing us. So
it's a great honor for me.
It's a great honor for us too.
And also we will do this stream next week again. Welcome.
Yeah.
Same time, same week.
I think we cannot do on Pazartesi.
Monday.
Monday. We can do it. I think in Tuesdays. Okay.
We will be scheduling it again. So if you have any questions in the meantime, please ask it through our DM, and then our coordinators will be answering you back with the help of our dentist.
Yes.
Thank you very much for sharing time.
You can ask everything.
Yes. Have a great day.
Yeah. See you.
See you.